So what we're going to look at today is a potential fracture of the fifth metatarsal head. Now here's the fifth metatarsal head, and this is actually sitting slightly superior to it. When I palpate on this area, the patient is actually quite uncomfortable. And then when I use the tuning forks, okay, whether it's the 128 or the 256 megahertz tuning forks, both elicit pain. So we have several signs that are potential indicators of a fracture somewhere in this area of the fifth metatarsal head. So what's KT tape going to do with this? Well, when you have pain, you have inflammation. So one of the things it's going to do is help lift the skin to reduce the inflammation. Secondly, we can now approximate some of the tissue, which can then potentially help to reduce some of the effects of the fracture. So what we're going to do, I've already got the foot prepped, I've cleaned it with rubbing alcohol, dried it off, and what I want is the foot exactly like you see it, completely relaxed, and I have now taken a full strip, cut it in, fold it in half, okay, so now I have two 5-inch strips. I will only need one. So what I'm going to do is tear and twist and tear, and then take the centerpiece off. Fifth metatarsal head, and I'm going to very carefully, with about 5 to 10% tension, place this over the area of concern, rub down in the middle. Okay, there should be no tension on the ends whatsoever. And no tension on the ends whatsoever. Now the idea again is that we're going to try and reduce the pain of our patient right here in the area of the fifth metatarsal head. And we'll note this with further examination later on today. But this is the way that I like to tape fifth metatarsal head. Whether it's just pain, potential fracture, this will definitely help to reduce some of the symptomology.